So welcome everybody to another Leo live session. Really excited to have you with us. And we're going to give it about another minute and we'll start full speed. And great to see so many familiar names. And as well, and colleagues, families. And welcome to the fall. I guess we're fully in the fall now, right? And Halloween's around the corner, one of my favorite holidays from childhood. I'm not able to dress up anymore, but I might, you never know, actually, right? I don't have to go trick-or-treating, but I could dress up.
For the grandkids, Leo, for the grandkids.
Yeah.
I was going to say,
no,
exactly. You can go with your grandchildren.
Well, what's funny is the girls, I would always take them, and then but I haven't been doing it with the grandkids. We do other holidays and stuff, so that's when we haven't been doing. So, and I don't want to bust into the mojo, but maybe with the other grandchild, since he doesn't have any routine yet at 20 months old, there'll be a chance there. But yeah, welcome. And we're in month 31 of this COVID drama that is so tough on so many people, including organizations, families, individuals with disabilities. And one of the reasons I really wanted Ellen with us is because a lot of times, and especially the next several weeks, we're going to focus on the crisis that we're in together. And that's really an important point. So Ellen Attaliades is the CEO of ADDP, the Association of Developmental Disabilities Providers, but she also had been CEO of a provider, Edinburgh Center, and she's also had board service at ABH, which is, focused on behavioral health as a trade organization. And I think you served as past chair of that as well, Ellen.
Oh, yeah. Yeah.
It's my recollection, among other things, other boards, right?
That's correct.
So as leader of a trade organization in our field, we work actually closely together. But importantly, she also gets a chance on national issues through ANCOR, which is a national trade organization for organizations providing services in the area of disabilities, specifically, I think more so ours, intellectual developmental disabilities area. And so I want to, happy to have her with us today. And Ellen, I don't know if you want to say some opening comments before I get carried away and get into it.
Sure. So I'll just add a little bit to my prior history because I think it's important. I actually started my career at the Fernald State School. That's what we called it at that time. And I was there for almost 5 years. And I like to say I transitioned into the community as many of the people that I served transitioned into the community. So I'll just add that. So.
I didn't know that about you. You probably told me and I forgot it.
Yeah.
And sometime I'll have to ask you about the people because I know a few people that had been there probably at your time too. Yeah.
Oh yeah. Yeah. There are a lot of CEOs and a lot of people who work for DDS that were there at the same time that I was. So, we go back a long time, many, many years. Yeah. Of course, I only started when I was 11. So.
Great. So one of the big things, so we've had actually organization leaders speak before, folks, overseeing services, probably in the beginning of COVID, especially. But one of the big things going on right now, Ellen, is, as you know, I'm wondering, first, why don't you tell people about what ADDP does as an organization, just so people have a little background on that. So.
Okay. So the Association of Developmental Disabilities Providers, also known as ADDP, we're a statewide association. We represent 134 organizations who provide an array of services to people with intellectual and developmental disabilities, including autism, and also people with brain injuries. And I would say the most important thing about our mission is that we promote and ensure the strength of our community-based providers so that our members can be successful in ensuring there's access for people to come get services and also to maintain the quality. That's part of our advocacy and also the value of services in the community. I would say our ongoing work is really to work with both the state administration, the legislature, about protocols, policies that the state wants to develop. And I'm pleased to say at this point, I think we have a seat at the table a lot. when new policies are getting developed rather than being reactive. In addition to working with Leo and I we meet every single Friday. We connect, so we're on the same page a lot and know what's going on. But I also work very closely with the Collaborative, and the Collaborative is a coalition of 4 state trade associations. So the Association for Behavioral Health Care, the Providers Council, and the Children's League. And we work closely and have meetings with the Executive Office of Health and Human Services on a regular basis, which has really done wonders throughout the pandemic. So I guess I'll stop at that, Leo. That makes sense.
Yeah, no, that's great. And as I shared earlier, like for the next several weeks, we're going to talk about, we're focused on the crisis, and a lot of it from a family perspective, from family support folks, from families themselves. And we did this as well last fall. We late in the fall into January, right? We were talking about the crisis, and I don't know how much really, some things have changed, right? But I think it'd be helpful from another perspective to share about it, which is the provider perspective that we don't talk about as much. And that's not to say, I really want the families on the call to understand that this is important for families to know about and for us to know about, not to back off our advocacy, but more to understand, right, the extent of the crisis, be more educated about it. So I do think that's great to have you here to talk about that. And so what is the provider experience right now? What is the range of challenges they face? And then let's start there. Let's start, not too complicated.
So I think the biggest the biggest challenge that our providers are facing are clearly the workforce crisis. And even though we had a workforce shortage prior to the pandemic really exacerbated. Staff are the backbone of the community human service system. If we don't have staff, things can't get done. I think one of the things that we have been advocating for is clearly higher salaries, but we also need to look at other ways to get people in the field. I think the biggest challenge right now, one of the biggest challenges is that we have many people that used to attend day programs and are no longer attending them. Some have come back. Our numbers in February were that there were about 7,000 people that were not receiving services, either through day HABs, day habilitation programs, or through the DDS funded services. That number has decreased a bit down to about 4,500 individuals. But we know this is a huge strain on family members, some of whom have had to leave their jobs or cut back on their jobs to care for these individuals. And lots of the individuals that are home are probably the people with the most complex needs because they need additional staffing. And there's just not enough staffing. I think what also has happened is just because programs are underutilized, then the provider agencies are having a really tough time getting reimbursed. And we've worked very hard over the last couple of years to get program enhancements, to provide some funding to help people transition through to when we get back to normal, if we ever get back to normal. I think the biggest thing that we're working on now is just day services. There's still many people that are at home with their families, and there's still many people that are in their residential programs that because of staffing, they can't return to day programs because of transportation issues. It's very difficult to get back to day programs. So that's a big thing. And then the financial impact clearly is huge. And then I think what we have to do is, really have to figure out a way, salary is very important and we're advocating for that, but we really have to find a way to get more people into the field. Now with remote work, and people can work at places like Target and McDonald's at higher rates, these jobs they're tough jobs, they're really rewarding jobs. And I think we have to find a way to let the public know, to let kids in high school know, to let kids in vocational programs kind of learn about what this job is. There's many people have been in the field for years because they're so committed to the work. We've got to get that back somehow.
Well, I mean, you'd probably, I mean, I think the salary, unfortunately, is like number one right now, getting the state, right, to make it, a reasonable approximation to what people can get paid elsewhere. I mean, it's hard for me to even believe that they don't get it, and I can say that, you don't have to say that, but that's how I feel about it. I think it's sort of, and I just got a text again today about somebody in Southeastern Mass who, and it really puts the provider in a bad light, even though they can't do anything about it right now. They don't have the staff. And here's a guy who needs some of the day, 1-to-1, and he's been out 31 months. And this is what organizations are facing. And one thing we're trying to, I think anyone on this call, if you could call your senator, your rep, just reinforce that the dollar piece is an essential ingredient here, in addition to what, Ellen, I think we need to do better at promoting and all of that. But if what's really brought us here, to the extent it's brought us here, honestly, is the crisis that was there before COVID and just been geometrically worsened. And I think people don't believe it sometimes, right? Because their experience is they just can't get back to work. But I think I understand that from the family or individual perspective. I can get that. I can't get it from the state perspective, not appreciating how serious it is. And I was just talking to people today, and maybe you could share some of the, what people are trying, because I'm impressed. Like if I was running an agency right now, right, and I had to deal with the turnover they're dealing with or the vacancies they're dealing with, it would be, one of my colleagues said to me, I have trouble going home at night. I want to have the people back and I want to have quality services, but my ratio isn't good. And she said this in a committee meeting with parents there, being upfront. And, maybe we're not upfront about enough, but, I think that's, people are struggling with that, right? Their own personal experiences, people committed to this field, the folks that you represent that are CEOs that are feeling terrible about the circumstances.
I think lots of CEOs are losing a lot of sleep at night. I think there's many CEOs that have decided to retire early. This is really tough, I think they came into the field and want to provide a certain level of quality service, and they know that they can't right now. There's just not enough people. I think it affects, not only do we want to restore the safety net, right? We want to restore people back to services the way they were prior to the pandemic, but people aren't doing a lot of expansion. I think in prior years, when new programs would come out to bid, people would definitely bid and figure out a way to staff them. They can't now. So, that slows down, I think, many parents that want their adult children who are turning 22, they need to get served. Any kind of new initiatives, I think, are very hard for the Department of Developmental Services to put through right now because they have to consider staffing. So it's not just new program development. I know I was at a meeting last week where it was actually totally unrelated, but people were because people always talk about the staffing crisis, right? And they were talking about, maybe depending on if Maura Healey is elected governor and she's very interested in housing, maybe housing is something that gets looked at, because so many of the staff that we do hire, or have worked for us don't have appropriate housing. If somehow we can provide them with some housing as a transition, and they can, and I remember this in, it was the late 80s, early 90s, when there was a lot of work going to other countries. I was at the Edinburgh Center at that time, and we went to Canada and recruited people from Canada to come work in our programs. And we actually had some empty houses that we were able to house some of the staff, and it really helped, I think, in terms of transition. So I think a lot of our providers are trying to come up with different ways to
That's a great idea. That's right. Yeah, those are the kind, so then you can recruit people easier. We are having trouble with foreign, right? We're having a dilemma with the whole, I forgot the initials for it, but there used to be a program, and it's really odd because
Yeah.
right? Yeah, yeah. And it's,
Yeah.
but your example is a great one. And if people try to do that, and then could Governor Healy or Deal, whoever's the governor, though, Maura Healy is leading significantly in the polls, would that be an, investment she'd make to help? Not a bad idea, right? So we have got to get creative to get people in the workforce here.
Yeah.
Anything else like that you're hearing about? Because that's a great, I hadn't thought, I remember that and I forgot all about that until you brought it up.
Yeah.
We used to have house parents in the early days. Remember, we used to have
that
in the
just
late
came up
70s,
on
early 80s.
Yep, that just came up on our residential call on Friday about how people used to have people who slept overnight, right? Did overnights and
Right.
were right there, and that would really help them. That's right, house parents. That would help them with rent costs and to be more accessible.
Right. To see
there were
our
a lot
colleagues.
of problems with that. There were a lot of problems with that, but it may be worth exploring and looking at it in a different way.
Well, one of our colleagues, we first met, the CEO of Working, started that way with her and her husband. So as house parents in a program for people with autism. So Cynthia Reed had a great point, National Health Service Corps. Why don't we add a category? Actually, Congressman Moulton has a bill in play that would do that, which would be great and would help basically pay loans, right? I think that's what you're getting at, Cynthia. And it would pay the loan costs of people that entered our field and committed to stay in our field for a certain number of years. So that was in play 2 sessions ago and last session. And I think, again, the pandemic really wreaked havoc on some of those recommendations.
Yeah, I think loan repayment. I know there is a I think it's called the Human Services Workforce Board. It's a legislative board that's looking at loan repayment for people in the field. I think also, and actually the secretary has talked about this, but people have thought about supporting people up front with college costs. I know ADDP has worked with UMass Lowell and also UMass Amherst, University Without Walls, to provide discounted rates for our member staff to attend and go back to school and get educated.
Yeah, ongoing education is big, right? For when you do have people. So actually, Maura just said there's an Air Force base on the Cape and that a legislator said could use for unused housing as well.
Wow, that's interesting.
Yeah, so yeah.
I do think we have to be creative these days,
Right, right.
Yeah, I don't know if you remember, Leo, but Chair Lon also has some very interesting thoughts about setting up a training site at the old Mount Ida that could kind of really bring a lot of people into the field to get trained. So some of the legislature is trying to be creative.
But we need the money. I mean, we need the hourly, the wage for sure. We were talking earlier before you came on, just that that is a huge problem, barrier is the salary, the hourly rate. And then that affects frontline managers, right? People, if they're covering shifts, I don't know if the feedback effect might be lost on people because we don't talk about that, the feedback loop of someone working extra hours to cover shifts because there's not enough staff. And eventually you lose that frontline manager. Suddenly a program director is doing what a frontline manager was doing. Is that fair, Ellen, to describe it that way?
Yeah, I think so.
And so people need, now, one of the things I wanted you to touch on is sort of more lately, what's been coming up is the friction that started to happen as, between people and services, even people that have services, right? Or the people, we estimate about 3,000 people turned 22 during this COVID period. If we assume 1,300 people a year, of which 300 of those are in the autism DD category, where are those people possibly going, right? I mean, who's serving them? I mean, and you've been kind enough to give me numbers about 20 sites that'll be day-hab sites that will have closed by January of 2023. So when you mention reimbursement and financial capacity, right? That's you're talking about that too. Agencies having to close down sites.
Yeah. So those closing down of day-hab sites, there's out of that 20 or 25 sites, there's probably only 4 or 5 day-hab programs that have actually closed. a lot have been consolidated, but that has also cut down on the number of people that have been able to be served. I think one of the things we worked very hard at this year was to get the DAHAB rates up, and they, effective July 1, they did go up 20%, but, maybe too little, too late in some ways for some agencies as they're working with their boards, and, some of their boards just say, we can't do this. We can't continue to operate at the deficit we are.
You know what it came up on that? Let me ask you this question, because you would know about this. Somebody said to me, when the rule happened, and I don't know how much that does have to do with the RAP leaving DDS, but somewhere in the last few years, the rules got more stringent about staff being shared between day habilitation and CBDS programs, so that there were some organizations that were smaller, right? Or in the same, might have something in the same building. They were able to do more integrated work. They were able to share staff. And then suddenly that came to a stop. Does that ring a bell, or is that just?
I haven't heard, I've heard about that in the past, but the transition from DDS to Mass Health around ISS is happening over a 2-year period, not for new people, but for current, people that are currently being served. They'll continue to be served, which we think is huge, because I think we'll go through growing pains together and try and figure some things out together. So
one of the things that came up in relation, that's more of an individual advocacy thing, but which someone from DLC recently pointed out to me is over the weekend, actually, they wrote an email and said, you know what, now people are getting heads up that they won't have service coordination anymore, because the RAP was the major funding they received from DDS. And what's interesting, someone's getting that, what you call ISS, we call it, that's additional. So for those of you on today, for those of you listening to the recording, this is additional money that people need for one-to-one assistance, whether it's for lunch or it's for toiling and ADL, activities for daily living, right? Whatever it is.
Right.
And obviously it implies when those people go home to their residence, or many of them to their family home, they have those same issues that families or staff at the residence are dealing with, right? And they're at residence, is probably funded for that level of care. If they're with a family, they may get PCA money, right? If they're not getting DDS money. But again, the PCA money is literally for those minutes when they need that help. It's not if they have a behavioral issue, right? It's not if. So one of the big issues, the fact that DDS would be less connected to those individuals, and again, not your thing that you would necessarily be focused on, but is concerning to us, and it's new. We got to check that out. We got to dig deeper and get an answer.
Yeah, that's totally understandable. And honestly, DDS is concerned as well, because that was a way that they kind of kept a handle on things as well. Again,
Angela, go ahead.
Again, I was just going to say the fact that it's a 2-year transition, it does give us some time to see what comes up and what needs to be addressed, and how we can work together.
And Angela is asking, can you speak a little bit about reimbursement rate versus percentage that goes to wages? So, I mean, I think, we presented on that before. Yeah, so the rates, there's 2 different things going on. When you say reimbursement rates, I think you're talking about, why don't you start with the way rates, we've done a presentation on this and shown the numbers, but maybe you could touch on that issue so people truly understand how the salaries and wages work again.
Okay. So chapter 257, this may be too elementary, I don't know, but.
Be elementary, that's good.
Okay, is legislation that requires that the state set fair and adequate rates. So the way that the services are set up now is every other year, services that are paid by state agencies have to have a comprehensive review, or at least like a COLA adjustment. So they get reviewed, and the way, so rates have increased, so residential rates have increased, but the issue that we've been having is that the salary benchmarks, when rates are set, they look at program models. The salary benchmarks that have been used to set those rates, we feel are not competitive, are not where they should be. So for instance, the last residential rates that were set, the salary benchmarks were set, was an average of 5 different positions, because we don't have a standard occupational code for direct support professionals. And it was set at $16.79 an hour, which we feel is way, way too long. The state decided to benchmark that average of those job codes at the 50th percentile, which came out at the $16.79. The Collaborative and Leo and lots of other agencies have been advocating for those rates to be, the salary benchmarks to be set at the 75th percentile, because the rates that are set, let's say for July 1 of this year, are in effect for 2 years. And they use Bureau of Labor Statistics data that is actually pretty much usually the year before it's coming out. So we're already behind the 8 ball on what salary benchmarks should be. So that's, I don't, if people have any questions.
That's a good, no, and I'm going to reinforce what you're saying. So imagine, by the way, 5 minutes before that, it was $15.52 an hour. Just so people know that when I say 5 minutes, a year before, not too long before that, right? Even though the legislature voted for $15 an hour for minimum wage, right, in 2023, right? So just to understand, there is no mystery about this. The state sets the benchmarks, which means provider A, provider Z, it doesn't matter. You're getting a rate increase, and your rate increase is based on paying all your direct care staff. They've been there 3 years. They've been there 1 year. They've been there 2 minutes, $16.79 an hour. End of story. So guess what?
Yeah, that's right. The 50th percentile, right?
Right. And just think about it. That's usually, if you're doing a direct care program, right, direct service, that's, I don't know, personnel 70 to 80% of your cost. So what, you think you're not going to pay rent so you can pay a higher salary? So it's really important. We can't say this enough, that the whole, and unfortunately, and I'm going to say this, you don't have to say this, our friends at SEIU in the press and whatever have distorted what happens because they want to unionize more. I get it. Good for you, but don't lie about how the rates get established, because all that does is hurt the people we care about, our constituents. So the ARC gets really worked up about this because it's not right. Complain about providers if you want SEIU, but don't tell the truth about how the rates get set. And then pass through legislation, Angela asks, no, just for salary, no, that would be, what that would do is just topsy. We used to advocate for that 20 years ago. The ARC was a leading organization with the trades on advocating. It was called Access and Excellence Campaign. And then there was another one, Quality and something else. I can't remember the names anymore. And the problem with that was we would get some funding for increases, right? And in those days, millions of dollars, I can't remember how much, but then nobody was, housing was going up all the time here. Utilities were going up, travel costs were going up. There was nothing being given for those costs. So basically what was happening to organizations was, they again, were having that problem of how do we address increasing prices, increasing costs. So there is no need for pass-through legislation. There's a need to properly fund. If we all get on the same, that's why we're going to spend weeks on this issue and the crisis. This crisis isn't the only way to solve this crisis is step one. It's not, we're going to need to do many things, as Ellen said, but is to get the competitive pay going. So someone is not going to say, why am I working this hard? Or, manager has their shifts covered so they don't leave their job because they're working 70 hours a week to cover a house or an employment program. And on top of that, Ellen, we have the transportation issue, which is, I sat on a task force, it's about to end, and I did not get a whole picture of what we're spending, right, for the people, though one of your members shared with me his model. And what he's able to pay for those drivers isn't enough, the hourly rate, So and he was kind enough to do that, which I really appreciated. But that's something I think this task force, even if it ends, should have still a goal to look at that whole structure for human services transportation. Because again, our constituents rely on that. And even if we solve the day program, we're going to have families drive people, and then they end up being forced to use flex funds. I don't even know why families are being forced to use flex funds if we still have savings in the budget because agencies aren't contracting, at the high enough level, right, for services. Sorry, I just went off on a spiel there.
No, that's okay. That's okay. That's Leo. I know Leo. I'm sure you guys do. I did want to say, though, that the 75th percentile that we've been advocating for would bring people up to $20.30 an hour. Still probably under, right, what we'd like to pay people, but,
Right.
you know, at least it's a step in the right direction, I think.
And Ellen, is that a mean? Is that a mean or a median? When people get that as the benchmark, the only reason I'm asking you that is, it is, okay. And also just to remind people, that number, so you have someone that's been in that job for 4 years, right? Some people are already getting paid more, correct?
Right. And some people are getting paid less. I think, you know, the great thing about the ARPA money is that it provided some funding to pay for recruitment bonuses, for retention bonuses, but that's one-time money. And that's going to be ending soon. And so really, you know, our advocacy has really, you know, needed to be around regular rates. And that's why we've been advocating for the 75th percentile.
I'm going to ask you a question.
Angela's right on it with job codes for DSP.
Go ahead. Yeah.
And I'd love to answer that. But before I do that, I do want to say that ADDP did look at our members. We looked at their UFRs to see how much money they were actually spending on salary and associated costs, fringe benefits, and things like that. And we're, you know, close to 80%. That's just standard, their financial information. So, you know, agencies have different situations. You know, some of their jobs are different. Some people have unions. So that's why it's not like, you know, if you work for the state, somebody at this level gets paid this. There has to be flexibility, I think, in agencies just because of how they're designed, how their jobs are designed. So Anchor, which is our national trade, is very involved, and we've been very involved advocating for a standard occupational code, an SOC code for DSPs. It did come up about 5 years ago and wasn't passed through, but we feel like it's really important. The code that we would use, there has been concern in Massachusetts because we pay higher, but we would use the Massachusetts SOC code. So that's kind of how we, you know, get around that. But we do feel like it's really important for all kinds of reasons to have a direct support professional SOC code. So we're working on it.
Yeah. Good question. And related, I was going to ask a question related to that, and of course I lost it. So we'll go to Marin's question about family support and what about those salaries, and is there the same kind of turnover in family support?
I don't know as much about family support. I know for shared living, we do advocate for increases for caregivers and in adult foster care as well. Marin, can you talk a little bit about the family support services?
Well, yeah, I mean, family support services has seen quite a large increase, primarily because of the lack of day programs.
Right.
And so they're trying to support more people, but again, they need more staff to do that.
Right.
And attracting staff at the current salary, as we've talked about, isn't doing it.
Mm-hmm.
So, I mean, they're desperately needed to give families a break.
Mm-hmm.
But are you talking about the staff that coordinate, Marin, or the staff that come to the home and help out at the home?
The staff that come to the home or take somebody out or that kind of thing.
They would
they're direct support professionals.
Yeah, right.
They are.
They're in the same ballpark. So I would say, Ellen, you would say those rates
would be covered.
Right. And I'm not sure exactly. You know what's interesting, Marin? So sometimes they're personal care attendants, which need to go up in salary too through Mass Health.
Mm-hmm.
Mass Health is not covered by Chapter 257. Sometimes there's staff. Yeah, I'm trying. Would that be IS like placement services? And there's those kinds of things we got to look at to make sure those are tracking too, right?
Absolutely.
I know what I was going to ask you. I was going to ask you, Ellen, about. Do you know? I know some people are paying $20 an hour. 2 people told me. One person's waiting to see because he only just started it. Okay, he said to me he's got more applications than he's ever had. A second person told me they hired more people than they ever have. And a third person told me it's not having an effect. She's up in the Northeast. What are you hearing about people who are taking the chance? Because there was surpluses during COVID, right? Just so people understand, because they got ARPA money, or they got different monies, and that's what people are using, right? To take care of some of those transition decisions they're making. Because some are paying even over 17, but they're only getting benchmarked under 17, right? So they're, you know.
Right. Yeah. So Leo, it's all over the place. Some people that are you know, have made the decision with their boards to go ahead and pay $20 an hour are doing well. I don't mean that they're fully staffed. They just have more people coming in the door to you know, apply for jobs. Others have said it really hasn't made a difference. It's, you know, unfortunately, I just see this as being a long-term solution. You know, a long-term problem needing long-term solutions. I think, you know, as you may have heard, you know, the secretary always talks about how, you know, we can't create people, you know, but we really do have to kind of look at all the aspects that contribute to this and figure out a way to do more. The other thing I was going to mention earlier, one of the ways that we were really successful at my organization is internships. We had people come in for, you know, for either undergraduate or graduate level internships, and then they wanted to stay. Like, they liked our program so much. So, you know, if we could do that, even maybe at the high school level or the trade school level as well, do internships, get people interested in this field, and then, you know, want to stay on for their real life job. That may be a way to go as well.
So do you think people are so overwhelmed that they haven't, like, they just didn't have the manpower to do that outreach, right? Develop intern packages, brochures, right? Because it does take some time,
I just
right,
think people, you know, people are really, right now they're concerned about safety, health and safety, right? I mean, you know, we've gone through a pandemic, you know, they've served individuals that have been hit and or who have died, same with staff. I mean, it's, you know, that's very worrisome, you know, and that's still there, you know, even though things have gotten a lot better. But again, I think, you know, people who are in other jobs their jobs have changed to help support the direct support needs of the staff, and to make sure that the individuals that agencies serve are well taken care of. So
what aggravated the crisis, we should remind people, is when the day programs had to close, right?
Yeah.
And those people that had residential reallocated their staff, those that were willing, by the way, to do it, right? Some people say, no, I'm not going to work at night, you know, and these, well, I guess they could work during the day, right? As long as the day programs were closed.
Well, I think
but that had an impact, right?
Yeah.
And some people had to let people go. There was a way to let people go and still pay their benefits. I forget what you call that. Furlough people.
Yeah. But I
so
think
that had a, right?
Yeah.
Didn't that have a huge impact?
But I think if you look at the system as a whole, you know, you had people working multiple jobs to begin with, right? Because the salaries weren't at the right level. And then you have the pandemic and the need for overtime. And I know many agencies used to kind of have, you know, guidelines in place that you couldn't do any more than 20 hours of overtime because they didn't want people, you know, stretched or tired out. But that people had to disband some of those guidelines. And there are people, you know, people are working and they're working a lot of hours. It's a tough situation. It's a tough situation.
So this is what's great having you on. You're reminding us, right, of the different variables even before COVID that were in play. It was common for many DSPs or direct care workers to have 2 jobs, you know, or at least 1.5 jobs minimum, right?
Yeah, absolutely. Yeah. And do overtime for their agency, you know? Right.
And we didn't get like, you know, thankfully, but it was too late. We got that 10% bump right before COVID hit for the ALTR for residential, but we probably needed that 10% for a few years beforehand, right? And instead it was 2%. But, you know, this is really important for people to appreciate how low those COLA increases were. I'm calling them COLA, they're rate increases. I shouldn't call them COLA. Right. The other piece of that is the transportation piece, which I didn't fully appreciate till my colleagues said to me, well, a lot of the small transportation companies and even some of ours, we gave back leases because the vehicles weren't being
Right.
used, right? Is that
Right.
true?
Right.
So
Oh, absolutely.
then,
Yeah.
then you go, then it's because you had to financially. So now you're starting to have day programs again, and you're being told you get a vehicle in 6 months, but then it takes 12 months because of
Right.
supply chain issues.
That's right.
So these are the kinds of things. And again, getting that workforce back has been brutal. So again, now I'd love to, we're almost done with our time, but I did ask earlier, and the frustration, holy, Gene Simmons, great point, internships and people to say you still need this living wage. No question. It comes back to Gene, great point. Gene's just commenting that if we're not paying the wage, let's
Totally
not hear
agree.
people.
Totally agree.
Right. And the people who aren't agreeing to allocate the wage, of course, they're going to say we don't have enough people. There's a whole lot of reasons, right, to say there's other factors. But if you don't take care of factor number one, it's really not fair, right? So, Gene, thank you for your rant. We're totally on board with you. There are many good people out there who want to work, their constituents, but it isn't fair if they're not appropriately compensated. And so also we talk about it as a diversity issue at the ARC, and that many of the workers are from other countries, speak different languages as an initial language. So there's almost something, it's discriminatory about our constituents, and then it's discriminatory about our workforce. And of course, many women are in our field, right? So
we've actually been looking at it through the equity lens as well. Yeah.
Right.
That's right.
So the workforce / family individual conflict stuff, is that worse than it's ever been, do you think, because of, that people aren't able to come back, they don't have enough services, and then the only place to direct that is the provider that served you or might have served you or is refusing to take you as a new turning 22 person. Do you think that dynamic's gotten worse in the last months?
Are you asking me, or are you asking your?
Yeah, I'm asking you. I'm asking you. But anybody else could speak to this too. And, I know you're one step removed, but I know you and I are hearing this secondhand, right?
We are hearing this, yeah, that it's really, really tough. I mean, honestly, I think CEOs feel terrible too. They want to, they don't feel great that they're not able to service people, but they're kind of stuck, they're hamstrung. And certainly, when this falls on families, the strain on families, it's really a tough one. I'd be interested in kind of hearing some situations, and
anybody want to speak up about situations
better, or if they've
yeah. I heard a success story. I followed up on a call from a few weeks ago, and I just called you to thank you. I said I probably had nothing to do with it, but I'm so pleased. But you know what ticked me off? They took her flex money to pay for the transportation. And I said, well, hold it. We're not even fully using up the employment. And there is language we got into the budget, right? In the day thing, this transfer money, right? What's going on? So that's another discussion for later, with the higher ups. Yeah. But seriously, so what's the message, and a discussion I have with the administration, obviously. But anybody want to comment? Is it getting, because that was great news to hear from that one person. And then I got the text today from another person who's he's had his 5th med increase in a few weeks ago. And the person that provides AFC for them is actually trying to tour new places, and God bless them. I hope, they can be compelling, right? To some provider will say, okay, I feel bad. Let me get you in and start with 1 day a week or something. Anybody else have a story or know someone, or just share sad story, success story? Okay, well, we sombered everybody up. I think this was really educating. Oh, Cynthia just said something. Family support services are now being asked to provide in-person programs despite transportation being an issue. There were robust online programs that should be continued. We should encourage it. And, great points, Cynthia, on the online stuff. But many of the people I know we're concerned about, they need one-to-one support. The online may keep them engaged for a little bit, but the isolation is really tough.
Right.
So, but yeah, I think
so. The public health emergency was extended, so we have a few more months of telehealth.
But I think some agencies will continue it, Ellen. So if people look around,
they'd like to. I'm not sure their support from the state agencies.
Enough financial support. Okay, so we'll have to look into that and work with you on that as well.
I don't know if it's financial support or it's a philosophy of services, but
Leo, one thing, it's
Go ahead,
Angela.
Angela. Go ahead, please.
One thing I wanted to comment on is that people, the whole assessment now of, regardless of what one has, whether it's a home health aide, a PCA, a continuous skilled nurse, the assessment process is being butchered now because of the lack of workers there. So all of the hours, and you know, my daughter has medically necessary services that she needs, but they look at things very differently because there isn't the workforce there. So you take that and you apply that to all the DSP roles. It's, even if the data looks better now, it's very difficult to understand it because the hour, you know, utilization of hours, you can be authorized a certain amount, but they're not utilized. And the next time you go for an assessment, they cut your hours and then it looks like you're getting your hours met. So this is a very,
So
even if
Angela,
it looks
the
good, I don't
gatekeepers,
know if families
yeah,
are they are certainly
yeah.
not feeling the impact at home. It's a lot because there's multiple different components there, but even the assessments, everybody is trying to make it, the state is trying to make it look better than it really is. And that's scary to me. That's very, very scary. And it's real.
What I'm hearing you say is the gatekeeper, the person doing the eval, whether it's for Mass Health or it's for, you know, the managed
DDS.
care,
Yeah. Or
they're actually the ones cutting you further because you didn't use the service. Saying, well, you're getting by without it. Is that what I'm hearing? You say it's not a true assessment anymore.
oh, correct. On multiple fronts. Yes. Yes, yes, yes.
Wow. That's reprehensible. Wow. Okay. So that's another layer to this that I wouldn't people, well, we know this happens with PCA because my colleague and your colleague, Kathleen Amaral, is on the call. And we do know somehow our son gets older, but he needs less help for some reason. That's, you know, he's, and you know, it's not like an improving disability, by the way, right? Each year. So
And
we
I
always
think
want,
my concern comes in that they're cutting all these corners. They're getting the feedback of providers, which is absolutely critical, but there's often not the consumer voice
right, right.
for new regulation. And so it is like just, it's shocking what is happening right now, and it needs to stop.
So, you know, just to remind people, we did send over a week ago, maybe 2 weeks, we sent an urgent response memo to the state. We're going to hang in there with it. I expect we'll be talking to someone this week, and then I expect us to be simultaneously taking it to some friend legislators, and we are working also with MDDC, DLC, and Mass. I think those are the groups, Angela, to talk through what else we can do during this crisis. And of course, we're always working with ADDP on this. Mary asked, why was the legislation withdrawn on salaries? Okay, this is so here's the thing. Your voice, I know people are feeling bummed and whatever about the situation we're in, but we're having fewer emails, fewer phone calls than we had before. People are just, you know, on some level disillusioned, but your voice is going to make a difference in this. And I guess, Ellen, the simple answer is that for whatever reason behind the scenes, they chose not even to expand the dollars on top of the governor's dollars, whatever they were told. Because you know, the 230 million initially the legislature was huge, right? Because the biggest amount before that was 160 million. And before that, there were really small amounts, right? So they're thinking, hey, this is winner stuff here. You know, you're hitting home runs. But we don't know what was behind the scenes for the leadership to sort of pull. People backed off because they were asked to back off. Because I think I might have been, they wanted the governor made the weak proposal. Please come back with us with the right proposal. You know, that's my putting a pretty face on it. But Ellen, what's your reaction to it?
No, it's the same thing, Leo, really. I think everybody advocated and it really, we had lots and lots of members that met with local legislators, and you know, we were actually shocked because so many people were supportive of the increase. And again, the rate reserve in itself was a very good increase, but it's just not enough to support that $20.30 an hour, right? That would have been another $351 million. So, but I do feel like with the the development bill, we've done a lot of good advocacy. That was really nice to see that the Senate version of that bill, before we had the 62F fiasco where people need to, money needs to go back to the taxpayers when you reach a certain threshold. I do feel like we made a lot of progress with that, and we're hearing good things about that. ADDP and the collaborative have been sending letters. We are starting a kind of a media campaign to still say, hey, we're out here. Families are suffering. There's still lots of people not back to work. Still lots of people in, at their residential programs, not getting, day supports that they really should be getting. So we're hopeful that that's going to go through. We've heard good things, but I more take a optimistic versus a pessimistic.
Better to be optimistic, so well, thank you, Ellen. This has been great. Really appreciate you joining us. We kept you a little over.
Thank you for having me. I enjoyed it. No, not at all. I enjoyed it.
Good. And we'll get this up and along with, so we'll have yours and Hillary's back to back. And then Angela's going to join us about the nursing crisis in a few weeks. And then we're going to have some folks from family support centers and others. So, and I'm hoping we'll also do PCA as well, coming up as well down the road in November. So thank you so much for being with us. Thanks, everybody. And catch you soon. Take care.
All right, great. Thanks.